Since the beginning of the school year, there have been countless fights, threats, and even arrests in many districts in the city and the suburbs. It's more than we've seen in recent years.
Yeah, it's left many asking what exactly is going on. And tonight's Voices for Change, one agency here in Chicago says we are witnessing symptoms of America's mental health crisis. Past this blue entry, a safe space to open up. This is where many students in Chicago come for therapy. They might talk to Jillian Howard, one of JPA's therapists.
It's okay to let people know that you're scared. It's okay to, talk about your feelings and your emotions. These kids are going through a lot. There's a lot of trauma in the city.
In America, too. Recent research shows the mental health of children is worsening. JPA's president and CEO, Karen Foley, says teenagers are bearing the brunt of what the U.S. Surgeon General calls the defining public health crisis of our time.
At 42% of all high school students, it doesn't matter if they're on the North Shore or they're on the West Side or South Side, regardless of what school or what family, what their income is, 42% of them report feeling persistently sad. There's something going on that isn't working for our young people. We have to pay attention.
JPA has been attentive for decades. In 1901, Jane Addams noticed there were few, if any, advocates for children getting in trouble with the law. So she started the Juvenile Protection Association, providing the first probation officers for the first juvenile court in our country until it became a government function.
If you fast forward 123 years now, we are still working with children and families, now also with educators to provide mental health services.
JPA provides one-on-one and small group therapy. The nonprofit leverages Medicaid and banks on donations to ensure no student is ever turned away. It's now in 24 schools and 16 neighborhoods across Chicago, with a focus on the ones most in need, which happen to be low-income communities of color.
So we get a lot of referrals for grief and loss, depression, anxiety.
Jillian says children of all ages are grappling with problems that have existed longer than they have, and newer ones brought on by the COVID-19 pandemic.
Definitely lingering effects, because we're just now starting to see or realize how it is affecting us. It's nothing when they hear a gunshot. It's nothing when they see a fight. They're like, oh, this happens every day. But the realization is it is affecting them. They are more anxious. They are more dysregulated.
And that can show up in different ways, from a lack of focus in class to violent brawls in the halls.
Kids shouldn't be getting a free pass, and we're not talking about the work we do as if kids don't have to be held accountable for their behavior. They do. We all have to learn how to get along with one another. But I would say that it's more helpful for us to try and understand what's prompting those behaviors, what's at the root of that problem.
And JPA's new program, Connected Kids, C2K for short, is helping teachers answer those questions by pairing them with mental health professionals like Jillian. They're learning the right way to address issues in the classroom, and it's working, improving their relationships with students and reducing stress.
In the same way that chronically hungry kids can't learn, neither can kids who are chronically hurting. So we need teachers to understand that. We need teachers to be more empathetic. We need to help teachers and give them the support that they need and deserve.
So how do you know if your child needs therapy? Well, therapists at JPA tell me look out for changes in sleep patterns, hygiene, and eating habits, too. Isolation at home, sudden clinginess, sudden perfectionism, increased irritability, and a loss of interest in things they once loved are also indicators your child may need help. Now, a lot of those are typical behaviors for teenagers, so they said it's very important to know what's normal for your child and
what
what's
has
not.
changed. Right. That's good advice.